Public sector workers affiliated to Nehawu in KwaZulu-Natal accused the Provincial Health Department of arrogance. The workers vow to continue withholding services until their employer meets the 10% pay hike demands. The interdicted strike action is on its third day. Newzroom Afrika's Nobuhle Modise starts us off.
All entrances at Gray's Hospital in Pietermaritzburg have been blocked. Employees who worked the previous shift were unable to exit, and those on shift were refused entry. While workers protest outside the hospital yard, it's alleged that patients are not being provided food, and many that were transferred from other hospitals were unable to leave. KwaZulu-Natal Health MEC Nobuhle says it's unfortunate that the Pietermaritzburg Specialist Hospital has been targeted.
It is very unfortunate that you have health workers who made an oath to protect lives of the people, but are the very same people right now who have decided that they are going to stop their fellow co-workers from saving those lives. I must also indicate that health workers are very much aware that they are an essential service, and therefore when there is such a strike, they actually should not be affected, and they should continue with the work and allow their union to represent them in the different negotiations. So you are talking about a fire that is there today. There was a fire here yesterday, most of the day. In the evening, I went to Gray's Hospital, and there was still a fire. Hence, we had that engagement with the SAPS to get them to intervene, because we do have security personnel as a Department of Health, but though the personnel is actually manning the gates and making sure that the gates are not closed. However, the strikers are just outside the gates, and where they are is not necessarily a property of the Department of Health. Therefore, our security personnel cannot intervene. Hence, we requested the SAPS to come in.
Nehawu says until their salary demands are met, the strike action is indefinite. The workers' union says it engaged the department about skeleton staff, but was met with arrogance.
We are angered by the arrogance of the employer. Yes, in this hospital, in fact, all the hospitals in Pietermaritzburg and also in the Herigwala region, they are all closed until the employer meets our demands. Yeah, there has been some, I will not say it's a confrontation between the management, just that they are raising the concern that there is no skeleton staff. And as a union, we met the HOD on the 3rd of March to discuss the skeleton staff, but due to arrogance, they said they cannot negotiate that. That is why there's no one working in the hospital, and it's not our intention to make the strike affect the community.
Similar chaotic scenes took place around the province at different health facilities. There were also reports that an ambulance carrying a child in critical condition in Stanga was stopped and medical personnel assaulted for being on duty. The union claims some acts of violence and intimidation were not carried out by its members.
You see, the strike is very successful at the moment, and we are operating in a political space that is contested. Yeah, we are competing for the same members. So if Nehawu strike is being successful, yeah, definitely there will be a sabotage.
The Health MEC says her department is involved in efforts to resolve the crisis at hospitals around the province. For Newzroom Afrika on Channel 405, I'm Nobuhle Modise in Pietermaritzburg.